Have you ever wondered how administrative processes might be impacting the healthcare system? It's a question that's not often asked, but it's one that carries significant weight. Administrative processes serve as the backbone of healthcare, facilitating everything from patient registration to insurance claims. However, these processes, while necessary, can sometimes become a hindrance to patient care. One such process is prior authorization. This is a requirement that physicians must obtain approval from a patient's health insurance company before prescribing a specific medication, procedure, or service. While it's designed to prevent unnecessary procedures and keep healthcare costs down, the reality might be a bit more complex. A recent study has shed light on an alarming issue. It revealed that over 20% of individuals with cancer did not receive the care recommended by their healthcare providers due to the necessity of obtaining prior authorization. That's 1 in 5 patients unable to access potentially life-saving treatment because of an administrative hurdle. Not only did the need for prior authorization prevent patients from receiving care, but it also caused significant delays. Many instances lasted for a period of 2 weeks or more. These aren't just numbers on a page, these are real people, real lives, impacted by these processes. The study also highlighted another concerning issue: patient anxiety. The process of obtaining prior authorization, coupled with the uncertainty and waiting, led to heightened levels of stress and anxiety among patients. Add to this the increased administrative challenges healthcare providers face, and you have a process that seems to be more of a barrier than a facilitator. So, what exactly is prior authorization and how does it impact patient care? Let's dive a little deeper into this topic in our next scene. Prior authorization is a requirement that your physician obtains approval from your health insurance plan to prescribe a specific medication or procedure for you. This might seem straightforward, but let's delve into the layers beneath this statement and decode what prior authorization truly means. At its core, prior authorization is a cost-saving strategy used by insurance companies. It's a way for them to manage costs by ensuring that the treatments prescribed are medically necessary, effective, and cost-efficient. It's a process that involves your healthcare provider, the insurance company, and you, the patient. Here's how it works. Suppose your doctor determines that you need a specific treatment or medication. They can't simply prescribe it and send you on your way. Instead, they must first send a request to your insurance company, explaining why this treatment or medication is necessary for your health. This is where the term prior authorization comes from. The doctor must get authorization before the treatment can proceed. Now, this isn't an instantaneous process. The insurance company reviews the request, a process that can take anywhere from a few days to a couple of weeks, sometimes even longer. They may ask for additional information or clarification, causing further delays. It's during this waiting period that patients can experience heightened anxiety, not knowing whether their needed treatment will be approved or when they can begin it. So why does prior authorization cause delays in care? The answer lies in the time-consuming nature of the process. The back-and-forth communication, the review period, and the additional documentation all contribute to the delay. For patients with conditions that require immediate attention like cancer, these delays can be more than just frustrating. They can be detrimental to their health and recovery. Furthermore, the process places a significant administrative burden on healthcare providers, taking time away from patient care. It's not uncommon for healthcare providers to have dedicated staff members to handle prior authorizations, which speaks volumes about the complexity and time-consuming nature of the process. While prior authorization is meant to ensure that unnecessary procedures and medications are not prescribed, it can sometimes act as a barrier to essential care. This is a reality faced by more than 20% of individuals with cancer, as indicated by recent studies. As we move forward, it's crucial to address these hurdles and find a balance that ensures cost efficiency without compromising patient care. Now let's delve into the real-world impact of prior authorization on patient care. Imagine being diagnosed with cancer, a life-altering condition that requires swift, decisive action. In an ideal world, your healthcare provider prescribes the best course of treatment and you start immediately. But in reality, over 20% of individuals with cancer did not receive the care recommended by their healthcare providers. Why? Because they were waiting for prior authorization. This process, intended as a cost-controlling measure, can result in delays in receiving care. In numerous instances, patients have waited for 2 weeks or more before they could start their treatments. 2 weeks may not sound like much, but for someone battling cancer, it can feel like a lifetime. Every single day matters. Perhaps one of the most troubling findings of this study is the heightened levels of patient anxiety. It's not hard to imagine why. Patients are already dealing with the emotional and physical toll of their diagnosis. Add to that the stress of waiting for authorization, unsure if they will get the treatment they need. It's a double blow that can have serious consequences on their overall well-being. And let's not forget the administrative challenges. Healthcare providers are already juggling a myriad of tasks. Prior authorization adds another layer to their workload. They have to spend precious time and resources navigating through complex authorization processes, time that could have been spent on patient care. This isn't just a matter of paperwork, it's a matter of life and death. It's about patients who need treatment and healthcare providers who want to give it. It's about a system that is supposed to help, but sometimes ends up hindering. Clearly, prior authorization can have significant negative impacts on patient care, but what can we do about it? The need for change in healthcare policy is apparent. As we navigate the intricacies of prior authorization, we are met with an undeniable truth. The system needs reform. The toll it takes on patients, healthcare providers, and the overall efficiency of the healthcare industry is substantial. But what does change look like in this context? Firstly, we must consider streamlining the process. The complexity and time-consuming nature of prior authorization are significant issues that need to be addressed. One solution could be the implementation of advanced technology to automate and expedite processes, reducing the administrative burden on healthcare providers and ensuring patients receive timely care. Secondly, we must look at improving communication between healthcare providers and insurers. Miscommunication or lack of clarity can lead to delays in care and increased patient anxiety. Clear, efficient communication channels can help eliminate these issues, making the process smoother and more transparent for all involved. Thirdly, we need to think about policy changes. This could mean re-evaluating the necessity of prior authorization for certain treatments, especially those that are time-sensitive or critical for the patient's health and well-being. For instance, in the case of cancer patients, waiting for 2 weeks or more for treatment due to prior authorization requirements is not just distressing, but could potentially be life-threatening. In such cases, policy changes could ensure that treatment is not delayed unnecessarily, preserving the health and lives of patients. Lastly, we must also consider the need for more research into the impact of prior authorization. While studies have shown its negative effects, further research could provide a more comprehensive understanding, helping to inform policy changes and improvements. The road to reform is not an easy one. It requires collaboration, commitment, and a willingness to challenge the status quo. But the rewards are worth the effort. A more efficient healthcare system, reduced patient anxiety, and most importantly, timely access to necessary care. Change is possible, but it requires action. You can play a part in improving our healthcare system. Each one of us, as a cog in the wheel of society, can contribute to this change. The beauty of democracy is that it gives each one of us the power to influence policy changes, and it's no different in healthcare. We all have a voice, and it's high time we use it to advocate for a healthcare system that prioritizes patients over paperwork. By reaching out to policymakers, we can express our concerns about the current state of healthcare and the need for reform. A simple letter, an email, or even a phone call can make a difference. Policymakers need to hear from us, the people they represent, about the challenges we face due to unnecessary administrative processes. But let's not stop there. Advocacy groups are another avenue where we can amplify our voice. These organizations work tirelessly to bring about change in various sectors, and healthcare is no exception. By joining or supporting these groups, we can contribute to their efforts to streamline healthcare processes. They often have resources and tools that can help us understand the issues better and guide us on how to effectively advocate for change. Lastly, never underestimate the power of spreading awareness. Start conversations with your friends, your family, your colleagues about these issues in our healthcare system. Use the power of social media to share your experiences and ideas. You'd be surprised how a simple tweet or a Facebook post can spark a larger discussion and bring more attention to the cause. Remember, change is a collective effort. It requires all of us to step up and take action. The journey to a more efficient, patient-centered healthcare system may be long, but every step we take brings us closer to our goal. Together, we can work towards a healthcare system that truly puts patient care first. Let's make our voices heard, let's push for change, and let's ensure that our healthcare system serves us better.